Hello, I'm Dr. Shyama Mathews. I'm one of the physicians at Women's Healthcare of Princeton. Today, I'll be discussing hysterectomy. Hysterectomy is the removal of the uterus. There's often a common misconception that this also means removal of the ovaries, and it doesn't, not necessarily. Abdominal hysterectomies, performed in a multitude of ways, is one of the most common surgeries performed in the US. 90% of them are actually for benign reasons, meaning not for cancer. The most common reason is for fibroids, followed by abnormal uterine bleeding, and then pelvic prolapse. There are multiple different approaches to a hysterectomy. An abdominal approach means an open incision. A laparoscopic or robotic approach means that there are smaller incisions and a camera is inserted. And finally, there's also a vaginal approach in which the uterus is removed through the vagina. Even though minimally invasive approaches, meaning laparoscopic or vaginal, lead to less recovery time, less pain, less infection risk, abdominal hysterectomy is still the more common procedure performed in the US. There are several reasons for this. One is lack of patient awareness. Patients don't realize that they could have their surgery done in a minimally invasive way. Two would be lack of surgeon training. So OBGYNs are classically trained in both abdominal and laparoscopic as well as vaginal approaches. However, some may be more comfortable doing things abdominally based on the amount of surgery that they do. Three would be volume. A surgeon who does minimally invasive surgery all the time is going to be much more comfortable doing more complex surgeries, especially for larger uteri. These are things that you should take into consideration when you are considering surgery. These are things that you may want to bring up with your doctor and talk to them openly about. If they are not comfortable performing the procedure, it may be a good time to discuss it with someone who is a higher volume surgeon. Let's talk a little bit more about hysterectomy and the types of hysterectomy. There are two major types: supracervical, which means above the cervix, or total, which means including the cervix. The cervix is the bottom portion of the uterus. That's what connects the uterus to the vagina. People have been going back and forth as far as what is the better option for a hysterectomy, and it may come down to patient choice. There are reasons to remove the cervix. That would be if you have a history of abnormal pap smears, or, for example, you've been having severe pain or irregular bleeding that might be related to endometriosis. Those are good reasons to have the cervix removed at the time of your hysterectomy. Most concerns related to future prolapse and related to future sexual dysfunction, meaning problems with having intercourse later in the future, related to whether or not the cervix is still in place, have all been disproven by studies. Most studies have not shown a difference in sexual function before or after a hysterectomy involving removing the cervix. And most studies that have looked at prolapse have not shown a difference before or after a hysterectomy involving the cervix either. So those aren't really good reasons to remove the cervix. So one thing that can happen if a cervix is left behind is that somewhere between 5 to 10% of patients may continue to have a little bit of spotting after surgery. That might be a bit bothersome, but it's usually not severe. And it's usually not dangerous. So that's one thing to take into consideration related to leaving the cervix behind. Overall, it comes down to having a conversation with your doctor about what's the best choice for you, keeping or removing your cervix. Remember, we talked before that the ovaries don't necessarily need to be removed. In a patient who doesn't have a strong family history for ovarian cancer and does not have any abnormalities seen on the ovaries in the preoperative evaluation, they may decide to keep their ovaries, especially if they are far from menopause. Keeping the ovaries means that you won't go into menopause. You can continue to have typical hormonal function until the time that you would normally naturally go into menopause. That's usually recommended. The reason being, those hormones, the estrogen that the ovary continues to provide, is actually very healthy for your bones and your heart. These are conversations to have with your doctor and a decision that you can make in concordance with your doctor.